From 10 News, Tampa Bay's news leader, this is The Morning Show.
We'll get rid of cellulite with just one treatment. That's what a new device is designed to do, and it's called Cellulaze. And all this morning, we're going to be getting a live look into actually how it works. You're seeing live pictures right now from the Bassin Center for Plastic Surgery in Tampa. And coming up at 5:45, we'll be talking with the doctor performing this treatment, this new FDA-approved treatment, helping his patients to achieve a smoother and slimmer look.
From 10 News, Tampa Bay's news leader, this is The Morning Show.
I'm going to give you a live look right now from the Bassin Center for Plastic Surgery in Tampa. All morning long, we're going to be showing you about this new procedure. It's called Cellulaze. It reduces cellulite. Apparently, it's a breakthrough in this type of procedure. We'll be talking with a doctor coming up.
Okay, this is something that we've been talking about all morning, and we've been bringing you live pictures of a treatment going on right now. But one treatment and you're done. It sounds too good to be true. But for millions of women looking to get rid of their cellulite, a new procedure is making that process just a little bit easy and faster.
That's key, too. We've been getting a live look this morning. It's called Cellulaze. And the doctor, Mendoza, he's been treating patients at the Bassin Center for Plastic Surgery in Tampa for quite some time with this. And it's apparently a less invasive, although we've been seeing some of the pictures during commercial break, and it still looks invasive. Yeah. Let's go ahead and join Dr. Mendoza. Thanks for being with us this morning as you currently work on a patient.
Thank you.
What makes Cellulaze so different from other cellulite-type treatments, like liposuction, for example?
Basically, well, liposuction is not a cellulite treatment. All the cellulite treatments that were available on the market before this were stuff that you did on the outside of the skin that required a series of treatments. This is the only one that's minimally invasive, where I'm going under the skin like smart lipo, and one single treatment is going to give her long-lasting results that'll last, so far studies have shown, at least to 1.5 years to 2 years.
So, and the patient you have on the table right now, how long have you been working on her, and how long will the actual procedure take?
We started, we got her on the table right around 5 o'clock. Should take about 1.5 hours to 2 hours total.
And will she be up and going today, or what's the recovery process?
Yeah, she'll be able to get up and get out of here as soon as we're done. Usually recovery, just 1 or 2 days. They may have a little bit of drainage and some soreness, but aside from that, not a lot of downtime.
It looks very similar to cellulite. I mean, or cellulite's liposuction. The way you use the wand going into the skin. This is different.
The biggest difference is the tip of this wand is different from the regular liposuction wands. This one actually has like a V cut, like that, and the fiber shoots in like 90-degree angles, and that's important because with the cellulite, you want to cut these little fibrous bands. Where my red is, if you're seeing it, it's causing depressions in the skin. So this wand is going there and cutting all those fibrous band or septae. And then where you see the green, there's some areas where the skin thinned out and there's herniations of fat, and we turn that V so it points up to the skin and down. So we melt the fat and we point it up to the skin, and that stimulates the collagen in the skin and makes the skin thicken.
Doctor, is she awake right now?
Yes, she is. You can talk to her. I can ask the questions for you.
Goodness.
Well, I don't think we have a microphone down, but could you ask her, and is she in any pain? Does she feel it?
Just nod.
And they want to know if you're in any pain or you feel it?
I feel it a little bit, but it's definitely...
Just kind of like a tugging, I guess, Dr. Mendoza?
She said you can feel a little bit, but it's fine, more like a little pulling.
So, Dr. Mendoza, how do you determine how much fat or how much you are actually taking out? Like, is that predetermined?
This procedure is not liposuction. We're not taking anything out.
You're not taking anything out.
What we're doing is, cellulite is the depressions and the fat herniation. So what we're doing is, where the red is, we're releasing the bands underneath so the skin comes up. And where the green is where the fat is puckering up. So we're melting the fat in those areas, and we're thickening the skin in those areas. So there is no suctioning. Unlike liposuction, we're not removing fat and we're not going to be suctioning anything out. It's just purely a laser procedure.
Okay, that's a huge difference there. Thank you for clarifying that for us. We're going to continue to check in with you throughout the course of the morning show. And she'll be done probably before we're off the air at 7 this morning, right?
Yeah, we should be done a little before, so yes.
Okay.
Very good. We'll check back with you, Dr. Mendoza. Thank you, sir.
All right, thank you.
So I think that's what most people think it is. It's like it's liposuction.
It's because it looks similar.
Yes, but he's not taking any, because normally when we've seen procedures like that, we've seen it's kind of like jarring, because you'll see stuff being sucked out. And notice you don't see any of that happening there.
It's just burning fat is all they're doing. All right.
Okay.
Let's check in with meteorologist Bobby Deskins.
From 10 News, Tampa Bay's news leader, this is The Morning Show.
And fighting cellulite, the new procedure giving some women smoother skin. That was a live look, by the way, at a doctor performing that procedure as we speak. And one treatment and you're done. For the millions of women looking to get rid of their cellulite, a new procedure is making the process quick and easy. So we've been getting a live look all morning long at a procedure called Cellulaze. And Dr. Mendoza has been treating a patient. Oh, there, we just lost his picture. He's at the Bassin Center for Plastic Surgery in Tampa. We're going to try and reconnect with Dr. Mendoza coming up in just a little bit. But it is a new procedure that has just gotten clearance by the FDA to be performed. And Dr. Bassin is one of the first in the country and in the Bay Area to perform that procedure. We have reestablished contact with Dr. Mendoza at the Bassin Center, Plastic Surgery Center. Can you hear me?
Yes, I can.
Okay, thank you so much for joining us once again. How is our patient doing?
Oh, she's doing great. We're almost done with the procedure. I got probably like another 4 or 5 minutes to go.
Okay, so we've been getting a lot of questions since you've been on the air this morning. So we'll start with we want to know, how much does a procedure like this cost?
It depends on how we do it by areas, basically, or by zones. We start at $3,500 up for the first zone, and then we go up from there, depending on how many zones you want to do. Probably you can do 2 to 3 zones at one time.
And how many zones are you doing on our patient this morning?
We're doing 2 today.
2 zones, okay, and those are the thigh area, right?
We're doing the posterior thighs and a little bit on the lateral thighs.
Okay, and so we already established that this is different than liposuction, is nothing like it, and you're saying that actually, what happens to, you're thickening some skin, you're melting some things, what happens to the things that are melted?
Well, what happens here, like I said, this is different from lipo because we're not treating an area of removing fat. Usually on the posterior thighs there's not a lot of fat. So the small amount of fat that you do melt, some of it's going to leak out the hole for like a day or 2. It's a little bit of drainage, and then the body absorbs the rest of it. Okay, and so that'll take care of itself in a few days after the procedure, right? Correct. Okay, and you know, you recently received the treatment received FDA clearance, not approval. Can you tell the folks who are interested in having something like this done what the difference between clearance and approval? Well, what happens is the FDA approves the machine for use that has been proven safe, and basically the machine is just an upgrade or advancement on the smart lipo triplex that was already currently available. The biggest difference with this is the fiber's different. Like I said, it has that V shape in order to deliver the laser energy in a different format in order to cleave those fibers. If you can picture just a straight line shooting at it, very hard to hit those fibers. Now that you have a V, you can get those fibers cleaved a lot easier and release the depressions and the puckering in the skin. Okay, well, we're going to let you go so you can finish up on the patient. Thank you so much for joining us this morning. Okay, thank you.